right, I'm getting the signal that it's time. So I appreciate you all coming this morning. It shows an excellent support for youth here, but also youth in general. So I'm so glad to be able to give this presentation this morning. So I know most of you, I think, but for those who don't know me, I am Wendy Kovacs Cortes. My lovely parents in the back row over here. Lucky enough to be a raised Unitarian, so yes, exactly. So I appreciate that. There's some representation in the crowd here. So I am actually a licensed marriage and family therapist here in Illinois. I work mostly with youth who have been removed from their families of origin for whatever reason. So that's sort of my clinical specialization. But I'm also a certified trainer and instructor for youth mental health first aid. So this is the teeny tiny sliver of that 8-hour course. So if anyone is working with youth, in a bigger capacity and want to take that big course, let me know. We have a grant through a company that I'm with that we can get you into that class. So it's a little bit about why I am here today. We should have time for questions as we go, so if you have a really urgent question, let me know, and we'll definitely have some time at the end for questions. So it's a little bit about our time here together, and hopefully I can make the clicker work. Yes, awesome. So our time today, just really thinking about what is mental health, some ideas that we can bring forward about reducing stigma around mental health, and then also some practical tools for supporting youth. So let's start with a definition. Very important, right? So mental health is not just the absence of mental illness, but it's a whole system of psychological factors, emotional factors, social well-being factors. It's a piece of overall health. I think sometimes there's this sense of mental health being separate from physical health or emotional health or things like that, and it's not. Mental health, physical health, emotional health, it is all part of what we should be calling health, right, of our bodies overall. Mental health thinks about or affects how people think, feel, act, how they respond to people and things in the environment, how they relate to others, and even how they make choices. So mental health is something that's critical to this productive life that we're hoping our youth have, right? It's a sense of a piece of what needs to be considered in their overall health. So mental health lies along a continuum. At one end we have mental health, which we define as a youth being able to cope with their daily lives, adapt to the things that are happening around them, to be really present in the here and now. And when they notice something's not going well, they can reach out for help or a resource or some support and accept that help and support. So that's one end of the continuum. We move from there to mental health challenges, which means that there's some times when that youth maybe isn't so adaptable. They get a little bit stuck or they have some struggles in that moment, right? But it's not every day. It's here and there, or it's specific to a situation, right? From there we move to diagnosis, which is something that more happens from a professional, right? Obviously I'm not training any of you to be diagnosticians here, right? But what that place of diagnosis means is that symptom or that behavior or that struggle is interfering with that youth's daily life, right? It's gotten to a place where it's big enough that it's affecting their ability to live, laugh, love, and learn. That's how we sort of think of all those L's, right? So a diagnosis means that small symptom, the challenge, the behavior has gotten big enough to affect their day-to-day happiness, their day-to-day life. Okay? So we're really thinking about that as we're progressing. And then the other end of the continuum from mental health is mental health crisis, which we define as a time when the youth isn't able to use their own resources to manage what's happening. They need outside support for their safety, for their, to contain them, basically. So that's crisis. I want to make sure everyone hears this message. We all have mental health. Doesn't mean every moment of time feels mentally healthy, right? But we all have mental health. And I think society and a lot of media things are really pushing us to think about mental health as this thing that is hard to achieve. But that's our normal state, right? Things get in the way of that and pull us away from mental health, right? Stress and what we see in the media and life challenges. But mental health is sort of the the norm where our bodies want to sit. So we just need to think about that as we are looking at how we can support youth. So I want to then talk to you about the number one thing that you can all do to support youth with mental health, and that is to reduce stigma by talking about it. We need to let our youth know that we see them and that we are not afraid to talk about these hard things. Okay? Sort of that catchphrase now, if you see something, say something, right? Miguel's laughing at me. This is a phrase I like a lot, right? If you see something, you say something. So, reducing stigma means that we've created an environment or a space where youth feel comfortable coming to us to talk about accomplishments and challenges or mistakes. They know that they will be supported either way because they know that we have checked ourselves and our biases, that we are able to come into these conversations in a supportive way. So I think that stigma is often a problem because we haven't checked ourselves. When I see a behavior in a youth, am I thinking, this youth is being defiant, or they're attention seeking, or, right, like I'm assigning something negative to that? Or am I thinking, this is a youth that maybe needs some extra supports, or a skill, or a resource, right? So reducing stigma starts by us thinking about ourselves and what we are bringing into those conversations. Reducing stigma definitely means that we are meeting youth where they are at. We're not assuming we know why they're doing what they're doing or what they're thinking when they're doing that. That comes from a place of our own stuff, right? But instead we're saying, what's happening in you? What are you thinking about? What are you feeling? Why do you want to do this? Or why did you think this was a good idea? Or, however that flows into the conversation. So meeting youth where they are at, instead of coming from a place of our own assumptions, is part of reducing stigma. As I mentioned earlier, helping to talk about mental health as part of physical health or overall health to reduce the stigma around mental health being this separate thing that we have to achieve in a different place than our overall health definitely helps to reduce stigma. I put a note in there about, I did. Sorry, the slides are a little bit different. Sorry about that. It should have a little note about neurodiversity. I think that's kind of a catchphrase that we're hearing a lot right now. So neurodiversity just means that a youth is processing the world a little bit differently than is what we would consider maybe traditional. It's a good thing. We want neurodiversity in the sense that it gives us this creative problem solving. It gives us new ways to think about the old ways of teaching, right? But sometimes neurodiversity gets labeled as a mental illness because we're not thinking about it as neurodiversity. So separating neurodiversity from mental health challenges as far as reducing stigma. And then that last line, just a couple of little notes. Person-first language is in there. It says respectful language. Person-first language is part of respectful language. We used to say things like a depressed youth, which puts the symptom or the challenge bigger than the person. And now we know we need to switch that to really help empower people. So maybe it's a youth struggling with depression or a youth with depressive symptoms or, right, some way to put that person before their symptoms. So that's a language change we're really thinking about as far as reducing stigma. Good? Yes? Yes, thumbs up from over here, thank you. All right, I wanted to give you a few signs or symptoms to be looking for. And what I think is important to note is that most of the things listed on this slide, except for crisis, are things that we see in regular life with youth, right? Is it common for a youth to have a change in their hygiene routine, their sleeping habits, what they're eating? Think even with little people, right? They go through phases where they just don't want to eat something. Does that mean it's a mental health challenge? No. But it does mean that we should notice and we should ask. Because these are sort of like our warning signs, are like, this may escalate to something else, things to be looking for, okay? So again, we're not seeing this as an immediate huge thing but it's something that we're going to notice and ask about. So we're going to think about some physical signs, such as changes in that appetite or sleeping. They're more tired, they're more energized. Maybe their hygiene has really changed. Maybe how they look or smell or how their dressing has changed. So those are some physical signs to wonder about. Behavioral signs, we often see youth withdrawing from their social activities or from their preferred activities. Maybe some major mood swings, not just sort of regular life things, but some consistent or some bigger mood swings. Emotionally, we sometimes see this sense of hopelessness or helplessness, feeling overwhelmed, feeling disconnected, these sudden bursts of anger or crying, right? We were just talking about teenagers. Is this part of regular life for children? Yes, but does it mean that we are noticing this is a struggle that they're having? Right? Again, from mental health to mental health challenge means those struggles are happening. If we notice something when it's a struggle and say something and intervene and support, we can very often keep that from escalating to that point of diagnosis or crisis. So that's why even though we know these behaviors are often developmental, we're not going to overlook them as signs of things that we should speak up about. And then I did list crisis. We're going to talk about crisis a little bit towards the end of our time together today, but we are always looking for signs of crisis in youth also so that we can be there and ready to intervene. And so crisis might look like dangerous or self-harming behaviors. Self-harming behaviors could be not eating, exercising too much. It could be not sleeping, right? Those are things that hurt the body, because a youth is using them as a coping tool or using them to deal with feelings. Okay? So I think traditionally often we think of self-harming as like cutting the skin or burning the skin, but it's way bigger than that. So self-harming are all those behaviors that hurt the body that a youth is using to cope. Okay? So we're looking for those kind of behaviors, and then obviously more obvious suicidal or homicidal thoughts or actions. And that could mean a youth is doodling or drawing about death or dying, or maybe their Google searches or what they're following on social media is related to death or dying or a celebrity suicide or things like that. So I know that that's sometimes hard to think about, but there's out there. The social media world has a lot of good messages and a lot of negative messages. So thinking about that. So some things to look for. All right, so now I have 6 steps that we've outlined that sort of help to think about how you can support youth. And it's not like a prescription where you have to do step 1 and then step 2 and then step 3, right? But they're just ideas to think about when you're working with youth or interacting with youth or have a youth in your life who you want to support. So just some ideas about how to do that. Okay? So, I'm not sure. I think Steve uploaded an older version before we put our edits in from RE. Sorry. But anyway, the information is here. First step, though, I want to think about is the environment that you're creating. Thanks, he's trying to reload it up there, I think. Is to think about the environment, okay? So an environment is important because it creates that sense of you caring about the youth without it necessarily being related to their mental health. Right? When we're in environments where we are listening to youth, right? With these key listening skills, where we're coming into conversations being non-judgmental, right? We're putting our assumptions to the side, right? When we are participating in those conversations from a place of curiosity, right? We're asking them about their thoughts and their feelings. We're not assuming we know why, right? When we're patient, when we're able to say, hey, you don't have to talk to me, but I want you to know I'm here for you. Right? And what do we get from youth often before there's trust? I'm fine. It's no big deal. Right? So we have to come back to those conversations repeatedly, regularly, so that we are seen as people who can support them or who will support them. Okay? And I think part of that then becomes what we call reassurance. You're giving youth a sense of they're not alone with this hard thing and that you can handle it. As the adult, you can handle it. because that is not something everyone assumes about everyone else in the world, and that's an okay thing. But when we're supporting youth around mental health, we want to make sure that we are that person they can turn to. So we're helping them know you're not alone in this. It's not like this moment is hard and I can be here to support you. Right? So all of those things sort of come into this supportive environment idea. That dot point about sometimes people don't speak their struggles, I think that's important because with youth, we are often thinking about what we see, right? Even before we can have those conversations. And so sometimes when we're thinking about, in my mind at least, sometimes I'm like, why are they doing that? Right? But what I need to ask is, hey, I noticed this thing. Can we talk about it? Because it needs to come from a place where that youth is seeing themselves as seen and heard, not in trouble, right? So being able to wonder about, hey, I noticed this thing, or this thing is different right now. Can we talk about it? No, it's fine. Okay, I'm here for you if you want to talk about it. I just wanted you to know I noticed, right? That's how we open up conversations. That's how we get youth to know that we can be that safe adult for them. Awesome. So there's a point on there about initiating conversations, and I think that that can be one of the harder things that we're asking people to do. But I think that, again, what we know from our research into mental health with youth is that youth who have even one adult in their life who has asked them how they're feeling, how they're thinking, what's going on with them, are significantly less likely to be in a mental health crisis. It would be awesome if that was always their caregiver. I know, having a teenager, I am not always her person, so it doesn't have to be just a caregiver, right? That's why we have this community here. And I think that that's really important to say, that even asking a youth, hey, how are you doing? That can shift how they're thinking, especially if they're thinking in a way that's headed towards crisis. So starting the conversations are huge, coming from that I statement perspective, and it doesn't have to be like, I see this, right? Like, I mean, we don't want it to be awkward, but from that place of I see you, I hear you, I've noticed this, I see this change in you. Huh? Does that make sense? Yeah? Okay. It's a shift in language though, isn't it? Anything else? Not offering solutions. This can be really hard for lots of adults, especially helpers, right? Which I think a lot of us are. But what happens when we say, here's what you should do? Have they learned anything? Have they gained a skill? Do they feel empowered to manage things in their own lives? Nope. Even our youth are like, nope. Do I get a thumbs up or a thumbs down for giving advice? Yes, exactly, right? Thumbs down for sure. So this is a place where as adults, we sort of need to bite our tongues, right? And ask, do you want to problem solve this? Do you want some ideas about what I've seen other people do or how I've maybe handled it? But to be able to step back from giving them the answer, giving them a solution. Yes, please. Definitely. Yeah. I like, they're looking towards youth to make sure, right? Yeah, I agree. I think that can be, especially if a youth is saying, I don't know, I can't solve this. If they're feeling really hopeless or powerless, there's nothing I can do, right? Hey, I could give you some ideas. And when I do that, I often throw one out way in left field. You know, you could beat them up, right? Like whatever it is. And then they're like, ha ha. I'm like, okay, good, we're moving, right? So yes, I do think that, especially if a youth is stuck, that's a much better approach than saying, this is what you should do. Yeah, yes, please.
It strikes me that one of the tougher issues I've dealt with over time is if a young person crisis themselves, and how do they find help for that person? And, boy, those are tough situations sometimes.
Definitely. And I think that that is such a great example of why the shift in helping youth, supporting youth around mental health is shifted from waiting till they're at a point of diagnosis or crisis even to intervene. We're really trying to back this up to when they're starting to struggle, right? And if we're supporting youth as they're starting to struggle, then they have more skills to be able to bring to friends or to other places. And for me, a big piece of this active listening is to say, hey, if it's not you who's in distress, no problem, send other people to me too, right? We can help spread that around knowing that we are safe to at least one youth. And I think that it's developmentally, again, so many of these behaviors are developmentally appropriate at a certain dosage level, right? So it's appropriate for youth to want to help their friends, but they also don't have that sense of boundary or that sense of containment yet. So it makes sense that they're sort of sucked into that crisis developmentally. So that, again, we want to empower youth when we see those challenges to have those skills so that it's not pulled into that as much. Yeah, definitely. Excellent. Thanks. I see microphone ready, but everybody's nice and loud. All right, so they're just a little bit out of order. So these are the ones we talked about already, about that supportive environment. Okay, so open-ended questions, right? How are you feeling? What's going on inside of you today? Can we talk about it, right? What do you want to talk about? Do you want to problem solve this? Yeah, we want to get those conversations started. Not pushing them though, because if we push, what are they going to do? Right? But we're going to offer those questions, offer those options, listening actively, we've talked about, connecting with other supports. Now, this can be a little bit of an awkward conversation, I think, but it's such an important piece to think about with youth. Okay? When we talk about other supportive professionals, other supports in their community, before they need them, and in hopes that they may never need those additional supports, we are reducing the stigma around getting help, right? Both for that youth and everyone in their circle. So I might be saying things when I'm talking to youth about like, hey, I'm so glad you're talking to me. Do you talk to other people about any of these hard things? No. Oh, did you know you could? Did you know you have, a DRE or a minister or someone in your school? Have you ever talked to your school counselor? Do you even know who your school counselor is, right? Sometimes they're like, no way, right? But we start to talk about those other helpers, just like we would talk about community helpers, right? Do most youth know that you could call 911 in an emergency? Yes. Do most youth know you can call 988 in a mental health emergency? No, right? If we're talking about these supports, we're spreading around that sense of safety, that sense of support that comes from the community, right? I even say often to youth, like, they're maybe saying, oh my gosh, like, this is super hard for me. And I might say, oh yeah, I remember when I dealt with that when I was your age, it was really hard. Want to talk about it? So sharing some of that lived experience. But then I also might say, hey, I know this other person at our church who went through that too. Do you want to talk to them, or I can introduce you? Right? Or I know someone who is a health professional, right? I know someone who knows about when sports is really hard, right? I'm picking things I know from people in the room here, right? But that's how we connect youth to other adults too. We use those resources and help them think about their communities so that they're not so isolated. Because when youth start to challenge or feel challenged with their mental health, they often feel really isolated. Right? They forget how many other people are struggling in the world or in their lives. So connecting with other supports is huge. And teachers, coaches, people from our church, people from their communities. This could even be tutors or mentors or things like that, right? Yes, please.
In terms of connecting with other supports, one thing people who have a diagnosis of ADHD or other anxiety around tests or whatever, helping them feel comfortable asking for accommodations and getting the support they need so they can perform well in school and that kind of thing, rather than being too ashamed or stigmatized to even ask for help.
You bet. And that may sound like, hey, did you know that you could ask your teacher for some extra time? Or did you know you can ask your teacher to take that test in a quieter room? They're like, what, I could do that? So yeah, and I think that that also falls into this practical help in this last one, right? Did you know that these things are out there, right? And so often youth are like, wow, no, I had no idea I had a voice in this. I had no idea I had some power and control over how this goes. Yes, please.
I was going to say, as a parent, I feel like sometimes we have trouble coaching our kids on this because we don't know the resources that are out there. So it's always good to connect with other people who because you might find out that their kid actually is on an IEP or a 504, and like that those solutions are out there. And you just don't talk about it because it's not polite chit chat. So it's good to practice your own resource building before you're coaching other people on it too.
You bet. And I wish that was, and I think that's related to the stigma, right? I wish that it was something that we could talk about more, even adult to adult. Yeah, you bet. Yes, please.
And just, adding to what you're saying, a lot of times, kids are struggling.
I don't know if it's on. It is on, but
I don't know how to turn on, but a lot of times kids are struggling, and they may not even be in a place where they can advocate for themselves in that way. So I think it's really important, like you said, for parents to find out what the options are and go into the school and advocate for your child, because a lot of times you could tell the child, but they might not emotionally be in a place that they can advocate for themselves.
Definitely. I think the other piece that has both to do with connecting with other supports and this practical help is that there are a lot of call and text lines for mental health challenges all the way up to mental health crisis. All youth should know that there are supports 24/7 that they can get to, either from their landline, their own phone, even if it's someone else's phone. Hey, we need 988, can you call? Yes, for sure. 741-741, text line for the National Suicide Prevention Lifeline. We should know it just like 988 and 911, right? Yeah. All right. Very, very important that as part of our work with youth, that we are empowering them to think about how they can improve or maintain their own mental health in addition to having supports, okay? I know as an adult, I'm not always great about using my self-care plan. I often need reminders from people around me. Hey, my children often say, you're awful crabby today. And I'll be like, oh yeah, I should do something about that, right? So thank you, I'm not alone, I appreciate that. But our hope is that we're shifting this in our youth, that we're giving them this message way before the adults in this side of the room, right, got this message, right? We're hoping to give it to you when you're young so that you can see the importance of knowing how to manage those moments that are harder, right? So self-care can be things like learning how to take a breath, grounding your feet into the floor before that test starts to happen, right? It could be something as small as that moment of time of mindfulness or grounding. It can be as big as participating in your favorite sport or your favorite hobby, or going for a walk after school or on the weekends, or getting your body moving in some way, right? I think that it's easy to think about self-care from the perspective of big things. I take bubble baths, I do my nails, I go to this club. That's great. But it also needs to be things that you can do in that moment of time when someone just said something super rude to you and now you have to go take a test, right? So really encouraging youth to think about those big actions, those little actions, the things that they can do that connect them to the bigger world. volunteering, pets, nature, art, creativity. Those trigger a different part of the brain than just mindfulness stuff, right? So getting your body thinking from that sort of right brain place can often soothe some of those negative thoughts or things that are happening. So I think creativity, spirituality in that sense, very important. Huge to think about routines and helping youth to think about, if the morning is stressful, what can you do at night to help make this work better in the morning? And they're like, what, right? It's not stuff that just comes naturally, not even to adults, right? We have to think about these routines for ourselves. So helping youth to think about their routines. What does sleep hygiene look like in high school? I'm looking at my high schoolers, right? They're all like, but they don't know the importance of it until we give them that information, right? So what about eating? Eating becomes very difficult at certain times because you are running from school to sports to whatever practices you have or whatever clubs you have. So what does it mean to have a granola bar with you instead of just waiting to eat? Or to have enough water. Do you know how many of our youth are well hydrated? Like 0%, right? Probably adults too, right? We're giggling at ourselves. But hydration has a huge impact on mental health and your ability to adapt to the daily world. So helping youth to think about routines is huge. I put on there building mental resiliency. This could be positive affirmations. It could be helping to or learning to recognize those brain tricks that our brains play, right? When you get stuck on a ruminating thing or think something big is actually like, or something small is actually really big, right? Those are sort of brain tricks that happen because of how the brain's youth is changing and adapting. But we can help draw attention to that. Hey, has this ever happened to you? I know it happens to me. Does it ever happen to you? What do you do when you're feeling stuck like that, right? What do you do to care for yourself when these things are happening, right? So, in my opinion, I think every youth should have a self-care plan. I think it should be written out, even if it's in their phone, if it's on a piece of paper, if it's taped to their mirrors, whatever it is. I think every youth needs that, and they need some adults who are checking in on that. Hey, what did you do today for your self-care? Or what have you done recently? Or have you checked in on your self-care recently? Is there anything you want to take off, right? Going for walks is absolutely on my self-care list between the last snowfall and the first snowfall. So it's just not something that I love in winter as much. So I need to adjust that on my self-care plan when there's snow on the ground, you know? So being able to think through how we adapt that, but it takes adults to help check in on those things. Yes, please.
This gets me talking about mindfulness. You know, we have the opportunity to have our mindful group here at our church on Monday nights, and then other congregations like Unity Temple in Oak Park, they have 8:30 to 9 a.m. every day of the week online mindfulness.
Wow.
Boy, during COVID or since Donald Trump got elected, I've been attending mindfulness very regularly. It's amazing how helpful that can be to calm the emotional upset and anxiety and stuff like that.
Mm-hmm. And I would love if every school started their day with 5 minutes of that. They won't, but I would love that. But we can teach youth to do that for themselves, to give themselves that couple of minutes a day to do that. But it's a learned skill, right? Yeah. Yes, please.
I was just going to make a comment that I think this is an interesting opportunity, or what you're talking about here, with something I've struggled with anybody from little kids to teenagers, of often they want to feel special or unique, or there's that feeling, and even in adults, of, well, this is unique to me. Absolutely nobody else has this problem. I'm not going to go share this with them. I'm not going to talk to so-and-so. So I like the self-care practice, or that just gave me an idea of, this is unique of you're unique. We need to come up with a plan for you that works the best, and finding a way to get in that window of, so many kids, no, I don't want to talk about this with so-and-so. I'm not sharing. It's going to be embarrassing. And especially the school counselors, things like that, we've run into some issues with school stuff of, well, you could utilize, no, the other kids will know that I have this going on, and I don't want that to happen. So just touching on your opinion also of that uniqueness, individual, hitting that, but also getting them to utilize this kind of options.
Definitely. And I think that that's what makes self-care so great, that it should be related to what they like to do. And what's safe in their communities or what they have access to can be really highlighted in a self-care plan.
I just wanted to share that my son is 5, and I wasn't sure if it was too early to start like a gratitude journal with him. And I purchased one that just had like 3 like basic questions, like what are you thankful for today? What made you the happiest today? And then like a place for him to draw a picture. So we're using it to work on his like handwriting, and then also, obviously, like I also wanted to work on like my gratitude. So it's been helpful for me in that way as well. And then he's able to like color and to be creative at the same time. So I was again concerned it might be a bit too soon, but even like we've only been coming here for a couple of weeks now, and like I took him to his first kids education, and he said that what he was grateful for was his gratitude journal, and I thought that it just like melted my heart. But
Absolutely. What research tells us is that the vast majority of youth appreciate a self-care plan. They just didn't know they needed it beforehand. So that's beautiful. And no, it's never too young. I mean, I think probably therapists, kids have it worse off than others, but even when my like 3-year-olds were being 3-nagers, I'd be like, everybody needs to take a breath right now. And they'd be, my now 13-year-old would be like, and fall out, right? But it taught her, the ones who know my 13-year-old are laughing, right? This is so her. But that was something that she still does today. I'll be like, and she'll be like, fine, take a breath. Be like, yes, thank you. Like, I don't even have to say it anymore. I just have to be like, so never too early to start. Never. Yes, please.
Hi, I got here a little bit late for your conversation, but what I did hear, I want to thank you for what you said, because it was very enriching. I thank you for all the information. I wanted to mention that I've been in mental health for a really long time, and because I missed early, I want to make sure that it's kind of an ask and tell question. So what I have a problem with is children who are under the age of 25, because the law says they're an adult at 18 or 21, but I in fact know that they have not come on board totally until the age of 25. This is like a bone of contention. I think it's even something that's in mental health, because it's a confusion that, well, you're an adult, but yet you still don't have your total prefrontal cortex on board. And I don't even know if we talked about that or not today, but it is a big problem, because the government says you're old enough, and your kids still need your guidance till at least the age of 25, and yet they think they're an adult and can make their own decisions.
Sure.
Thank you.
You bet. And I think that plays into to the idea of when we are pushing youth towards these huge responsibilities without checking in with them about how they're doing, right? I think for me it's shocking how many young children are in these super competitive sports or these travel sports teams, or and lots of them love it and it's great, but there's definitely a group of them that have been pushed into that by adults, or honors classes or things like that, right? So I think the huge piece for me that comes out of that is, are there safe adults asking them, checking in with them? And that's sort of where we started today. Like, if you see something, say something. If a youth is acting differently, or they don't seem happy, or they seem like they're being impacted by this, right? It's about being able to have a safe adult who's willing to say, how are you doing with this? Definitely. Excellent. All right. We talked about this one. Very, very important for you as helpers, and it's a quick point, but I just want to make sure you know that you cannot be everyone's everything all the time, right? So knowing for yourself when it's time to say, right, I'm not ready for this conversation, or I'm not the right person for this conversation, right? even with my children, I might be like, it's time to call grandma, right? Check in over there, right? So just knowing our own limits, knowing what we're doing for our own self-care and setting those boundaries for ourselves. I know it's cliche, but you cannot pour from an empty cup. There's literally nothing to give, right? So definitely making sure we're supporting ourselves as we're doing this hard work of connecting with youth. Okay. Great, we are on time. I just want to spend a little bit of time talking about crisis quickly, because I know that it can be a little bit scary for adults to not feel like they have maybe those tools or know what to do if they see a youth who is in crisis. Okay? So we would consider crisis thoughts of suicidality, homicidality, or what we talked about earlier, that self-harm, which we call non-suicidal self-injury. If we see a drastic change in their behaviors, their thoughts, their interactions with people, if they are engaging in dangerous or risky behavior, more on that consistent way, basically things that are beyond the typical developmental things, or developmental thing that may be risky, but you can talk to that youth about, right? I think we see those risky behaviors increase, especially in adolescence, but a crisis is when that's more of a consistent, or when you ask a youth about that and it's more than just, I just wanted to see what would happen, right? They're like, no, I'm really thinking about hurting myself, or I did that to hurt myself. So when we see those crisis signs, we get help. If it's an immediate medical crisis or something that youth is in immediate danger, it's a 911 type of emergency. I wish I didn't have to say say this, but I think we know that 911 is not safe for all people at all times, especially mental health crises, just because we can't guarantee that the responders are aware of mental health things, but if immediate safety is needed, 911 is still our best option. You can ask for a crisis team to come. You can ask for no lights and sirens, right? You can say this is a mental health emergency, and ask for that. It doesn't mean they'll listen, but you can ask. Yes, please.
Hi, I'm new here, but I'm a social worker with a crisis background, and
Excellent.
it's coming to the 11th service. If you have someone who has a mental health emergency, don't call 911, call 988. And next week I'll bring business cards that have for anybody who wants to. Mm-hmm. Hi, I'm Jean.
Hi, welcome. I think the difference though is that 988 can't send someone immediately, right? They will talk you through a crisis, they will support you, they will help get those connections.
Immediate safety issue, yes.
Yeah.
And
Someone out of the house, if they're actively suicidal and you can't keep them safe, yes, 911.
I just wanted to add too, if you live in DuPage County and you have a crisis like that, the DuPage County Department of Health has a mobile crisis unit. You can call them and they will come right to your house, and it's free if you live in DuPage County. So
Yes.
a lot of people don't know that.
And hopefully that is spreading quickly. I think 988 is helping tremendously with spreading around the crisis support team idea. But yes, so 988 should absolutely be in your crisis toolkit. If it's something that is not truly immediately in danger, 988 is an excellent, excellent option. But if a crisis happens here in the building, does everybody know what to do? No. Okay. Call Wendy. No, we don't call Wendy. Our crisis sort of ripple out starts with whoever's at the front desk. Usually that's Tina or the greeter at the front desk, and that will ripple out and sort of start the internal process. Yeah. Yes.
Can I ask just a quick question about 988? Like,
Sure.
I know it exists, so yay, but I don't know, like, if you call, what do they do? Like, do they just talk you through it? Like, do they, like, what does that look like?
Sure. Do you want to answer? No? Okay.
I know a little about it. They will talk you through it, and actually, if they think that you are in a crisis where you're a danger to yourself or others, they will call the local authorities.
They can, yeah.
So 988 used to be farmed out all over the country, but now we have 988 callers that are right in this area, and they will call.
Yeah.
if they think it's an emergency.
So it's much faster than it used to be when it was first launched, because yeah, it used to be then national to filter down. But it's kind of like the text and call lines for suicidality, but more for the general mental health challenge.
Yeah, and it's not just for the person who's in a crisis. If you're a family member and you have someone in crisis and you don't know what to do, you can call 988 and get advice from them.
Okay, thank you. Because like I just to editorialize, like my daughter just in Girl Scouts did role playing with 911 calls, right?
Ah.
You know, like what's your emergency? Is the person stable? You know, those kind of things. And I realized like I've never done a 988 role play. Like I don't know what that looks like. And I've never called 911, but I know what I'd be telling them if I
Sure.
did.
Yeah, and 988's new enough. I think we're still working on that, and I think the bringing it local changed a lot of those protocols. But really, they're going to say, "What's your mental health crisis? Are they stable? What help do you need?" If you say maybe they're ranting and raving, and I can't connect with them. They may give you some suggestions. They may say, "Are there other people in the area? Are they safe? Can you remove those other people?" Right? They're going to talk you through some of that, like steps of a crisis plan. Yeah. I think in the back, yes.
I wanted to.
No, great.
Thanks. I wanted to mention something that I learned far too late. I struggled with my own mental health crises, and I ran into the issue as an adolescent that I would, especially the 741, the text number. I would reach out to them, and I ran into particularly trigger-fingery responders that, I said, "I'm not contemplating, but I'm struggling," and they immediately called the police because I said the word.
Yeah.
And something that I learned later is the difference that, they're fairly new as well, but the difference between hotlines and warm lines. That hotlines are ones that will call the police if there is, an emergency, if you feel that you are not safe or that somebody else is not safe, that's where to go. But if you are just in a depressive episode or in, a spiral of thoughts that you can get out of, it's not a dangerous thing, but you just need some support, those warm lines are extremely helpful.
Mm-hmm. Those call and text lines are very, very powerful. Excellent, excellent, excellent. All right. Well, I am around if anything else you want to talk about, both today and going forward. I definitely encourage you to think about one of the bigger classes for supporting youth, if there are youth in your life who need, or you may want to just have that extra support for you. Like I said, those NAMI classes or the youth mental health first aid classes are all there for you, but lots of resources out there. I appreciate you being here today to start these conversations internally. And I'm here if you have questions, but if you need to go, I definitely understand that too, because we're running right at time here. Yes, Bob.
I know we have good representation here from National Alliance on Mental Illness. I don't know if you wanted to say anything about this great resource right here.
Well, I am going to be giving a presentation next month, but I will say regarding youth, we do have at NAMI DuPage and Wheaton, we have a teen support group, and there is always a licensed clinician in that group.
Mm-hmm.
We also have a great parent group. It's called Parent Roundtable, and that's a great resource for parents that are struggling with a lot of these things.
Mm-hmm.
And come to my thing next month.
Yes, always
It'll
shout
not
out
be
to,
focused on youth. It'll be other things.
yeah, but no, always shout out to NAMI for sure.
You may not have the answer to this, but these have been some wonderful resources that have been listed. Are they in card format together? Are they on our website? How can people access this information more generally? I'd like to just present this to anybody who's willing to help with this. Immediately, my thought goes to having a little business card or something like that that has 911, do that first, 988, 741, what's the number to?
741, 741.
Yes, exactly, see? And then there's the DuPage crisis you just included and several others that this strikes me that everybody needs this information. Parents, youth, adults, everything that's going on currently.
That's a great idea, and I'm on board.
It should be on our website. It would be wonderful. Thank you.
Something that actually I'm starting to do is I drive around a lot. I'm centralized in DuPage. I live there, but I go to College of DuPage and I also go to work in Naperville and all around the area. And whenever I see, somebody on the street corner holding a sign, I try to give them a water bottle, and I decided, I don't like that, that's not enough. So I decided to start writing down tags with multiple resources for, human trafficking, for substance abuse, for crisis, for mental health intervention, things like that, and housing resources. The 211 number was really, really helpful as well. I started doing that, and it seems to have helped. I've seen a couple of people who have said that they've called and gotten some really awesome results from it. So that's something that the business cards would be extremely helpful, because then I wouldn't have to handwrite them.
Excellent. I love it. I love that the conversation is starting. Excellent.
And I appreciate, thank you so much for the work that you did this. I know that the conversation was mostly for teens, but just to express the obvious, this worked for us adults as well. Same process, right? Same process.
Yes, definitely.
And I would say, because I fly a lot, just like the airplanes, if you don't put your oxygen on first, you cannot help someone else, right? So those of us who care for others, we need to do this first.
And thank you all for being here. I appreciate it.